Hey, it's Dr. John again with the Healthy MD coming to you again with another update about COVID-19, specifically the Delta variant, and had already done one quick episode on it and got some more questions. So wanted to do this update just again so people understand what's going on, why there's such a big concern about this new Delta variant. So let's dive in. Delta variant, why is it different? And I think one of the big issues that we're starting to see is that there's a change on that spike protein that allows the Delta variant to latch on a little bit easier, or actually a lot easier, onto the cells in the back of the nose and the back of the throat. The easier that Delta variant COVID-19 virus can latch on, the easier it is to infect those cells. The virus essentially takes over those cells and uses those cells as basically a viral replication factory and just puts out millions and millions of copies of the virus. The other issue with this mutation that the Delta variant has is that apparently the change in the spike protein, or the mutation in the spike protein, makes it more difficult for the antibodies, either from our own body or from the antibodies we've developed from getting the vaccine, to latch on to the Delta variant COVID virus as well too. So kind of two things: easier for the Delta variant to latch on to our own cells, harder for our antibodies to latch on to the Delta variant to actually destroy it. So kind of a little bit of a perfect storm with that. Now, the other interesting thing with the Delta variant is that it also replicates, or the time from you've been infected to the time of incubation to the time you can infect someone else is actually rapidly decreased. So we're talking about how quickly a virus can spread, or any type of infection can spread. There's a number that we use, or a factor that we use, called the R-naught factor. And that's either usually you'll see like an R with a subscripted 0 next to it. So the R-naught factor tells you how many people one person can infect with the virus. So when COVID-19 first started, the original version of it, probably about 2 people, or an R-naught of 2, were infected by each person that had COVID-19. And then they would turn around, and with an R-naught of 2, they would also infect 2 people, and those 2 people go on and infect 2 more people, and so on and so on. And that's how it spread. It's a slow but exponential growth. And that's what we saw previously. The Alpha variant that we saw last year, that started off in the UK, had an R-naught probably somewhere around the 3.5 to 4 range. And so again, so one person can infect 3.5 to 4 people on average, and then they each individually turn around and infect another 3 to 4 people. Well, the R-naught value that we think that the Delta variant has is somewhere between 5 and 8. And what that means is that each person can infect between 5 and 8 people. So if we use the 8, as the R-naught, that's pretty impressive exponential growth. And I'm going to walk you through how that works from a math standpoint, and again, hopefully visually show everyone how quickly this can spread with this Delta variant, and that's why we're so concerned about it. That means one person can infect 8 people. And again, quicker, so over a 3-day period, that one person can infect 8 more people with COVID-19 Delta variant. Well, let's fast forward another 3 days. So day 6, those 8 people who have been infected, incubated with the virus, can now also spread it to another 8 people. So those 8 people go ahead and they spread it to 64 people. Fast forward another 3 days, we're only at day 9, we have 64 people infected with the Delta variant COVID-19 virus. They each go on and infect another 8 people. So that's 512 people over 9 days that are infected with COVID-19. Fast forward another 3 days, day 12, 512 people infected from that first person. Now turn around and infect 8 other people. So we're up to 4,906 people infected, and we're only just into not even into 2 weeks. Go to day 15, and those 4,000 plus people infect over 32,000 people. So each of those 4,000 people infect another 8. We're over 32,000 people infected, again, from that one person 2 weeks ago or 15 days ago. That's how quickly this spreads. A little bit more math, we keep going on. 3 days later to day 18 from the original infection of Delta variant with one person, that's now spread to almost well over 25, or that's now spread to over 262,000 people from one person. We get to the end of the 3rd week, just third week, and we're looking at over 2 million people infected. Again, that's a R-naught of 8, and it's exponential growth. And so that's what we're concerned about, is how quickly this gets out of control. And we're starting to see this in pockets of the country that aren't vaccinated. So that's a real concern, is that how quickly this can spread. And even if you want to use a R-naught of 5, meaning that one person infects 5 people, the data is still pretty scary with that too. And that's really the concern. That's why the CDC is again recommending, if you're in a high risk area, go back and everyone mask up if you're indoors. Why they're still pushing vaccines, because the more people that get vaccinated, at least hopefully that slows down the spread a little bit, or it also prevents people from ending up in the hospital. Because even though vaccinated people are coming down with COVID-19 and they can still spread COVID-19, they are not the ones ending up in the hospital. It's the unvaccinated folks, the folks that have not been vaccinated against COVID-19, that are getting the worst effects of this. So again, that's something really to consider. And if you haven't been vaccinated, or family members, friends, family haven't been vaccinated, really, talk to them about it, and really kind of push them to talk to their doctors and healthcare providers about getting vaccinated. It's covered by the CARES Act, so there's no cost to folks for it in the US. So that's another benefit. And again, really helpful. Immunity kicks in usually about 2 weeks afterwards. So still not too late to get the COVID-19 vaccine. One of the other questions I'm getting from folks is, I got tested with COVID and I'm positive for COVID. Can I tell if it's a Delta variant? Well, the truth of the matter is that those tests that are commonly done, if you go to any of the commercial labs or outpatient labs, aren't going to tell you if you have COVID-19 Delta variant. But right now, about 90% of the cases we're seeing in the US, we're assuming are Delta variant, because Delta spreads, it's much more transmissible. So it's overtaking all the other variants, or all the other previous variants of COVID-19, and becoming the predominant variant that we're seeing. It doesn't change how we treat it from a medical standpoint. It's still COVID. It's still gonna have the effect on the bodies that it does. So knowing if it's Delta versus Alpha versus Beta, not too much of an issue from the medical treatment side of things. The state health departments and the CDC do some screening or some surveillance to look for different variants, and so they're doing additional testing. But individually, you probably won't know if it's truly Delta, and part of that's just the way the tests are done, because they're looking at those viral particles and not the full virus. But that's one of the other questions I've been getting from folks is, can I find out if I have the Delta variant or not? Again, it's not really that important for a treatment standpoint. If you've been diagnosed or had a positive test for COVID in the last 2 weeks in the US, 80 to 90% likelihood that it is Delta anyways. So, that would be my response to that. So again, just another quick update. Wanted to keep people informed. Again, try to put into numbers what's going on with this Delta variant and why we're really concerned about it. And hopefully the numbers make a little bit more sense to folks, and you can see how quickly in this exponential, explosive growth of how quickly this Delta variant can spread. Again, so much more quicker than what we were seeing with the original COVID-19, the Alpha strain, the Beta strain, some of the other strains a little bit more transmissible. This is really a super COVID. This one is much more transmissible. So again, follow the recommendations. Mask up if you're indoors, even if you're vaccinated, especially if you're in a high risk or high prevalence state or city where there's a lot of COVID being diagnosed. Then I'll have more updates. If you have other questions, put them down in the comment box. I'll try to answer them the best I can. And just want to say again, appreciate all your input, appreciate the likes, appreciate all the subscribes. Stay safe out there. Hey, this is Dr. John Martinez with the Healthy MD, and I'll be back again with some more information.